Hello, everyone. I'm Kat Navarro with the B Foundation for Brain Aneurysm Prevention, and I'm excited to be talking to one of the recipients of the B Foundation's 2025 Brain Aneurysm Preventative Research Grant Program, Dr. Andrew Hale from the University of Alabama. How are you doing today?
I'm doing well. Great to see you, Kat. And yeah, really excited to be here.
Yeah, it's so good to see you again. So you guys might recognize Dr. Hale from being one of the recipients from last year's research grants. This is very exciting because this is the first AVM research grant that TBF has awarded. So that's a huge deal. So I'd love to have you talk more about that. But before we get into that, maybe just a little recap for people who don't know your background and haven't seen the interview from before about why you got into neurosurgery and just a little bit about you.
Great. Well, thank you so much. I'm humbled and honored to be able to receive the first AVM grant that's been sponsored by the B Foundation. So I grew up in Hudson, Ohio, which is in Northeast Ohio, really with an interest in medicine that started in high school and then decided to go to college at Case Western Reserve University in Cleveland and really found my footing in a research lab where we were studying actually blood vessel development and the mechanisms that regulate blood vessel development in both in tissue culture models but also in mouse models. And so as I was thinking about what I wanted to do kind of with my career and the rest of my life, I stumbled upon combined medical and research degree granting program called MD PhD program. And so I completed my undergraduate work at Case Western, stuck around for a little bit in a research laboratory, and then ended up at Vanderbilt University in Nashville. And in Nashville, I got my PhD in biochemistry, kind of mouse genetics laboratory, really trying to understand at a really basic molecular level what was going on with a particular signaling pathway called the inositol phosphate and PI3 kinase pathway. And I really found myself, thinking about ways to translate my interest in the lab and helping patients, and got involved in a variety of different neurosurgery projects. Really connected with the folks at Vanderbilt and had some really great mentors there, and then entered the match, and then ended up now at University of Alabama at Birmingham, where I'm a PGY5 neurosurgery resident there, and really trying to think about ways to combine my background in biochemistry, genetics, and neurosurgery to help those patients.
Okay, thank you. Yeah, I know that, that connects with what we talked about before with your research grant last year. And so leading into your project for this year, can you kind of explain it to us in just a way that everybody can understand?
Yeah. Yeah, so we're interested in AVMs, which are arteriovenous malformations, which are abnormal vascular malformations that result in an artery directly connects to a vein without an intervening capillary bed. So this creates a high flow vascular lesion that can occur in the brain, and most often these AVMs are not discovered until they hemorrhage. So similar to aneurysms, patients will experience, the worst headache of their life. They may pass out, they may go into a coma, they may slur their speech, or have a neurologic deficit that's recognized by other people, and that prompts medical attention. The challenge with AVMs is that they are can often be very large. They can have a large bleed that then can require either surgical evacuation or for that blood to dissipate before the lesion might be ultimately treated. And these AVMs can be treated through a number of different means, through endovascular embolization, although not as a primary treatment. Also surgery, which requires, craniotomy or removal of the skull, and in circumferential complete removal of the AVM, or radiation therapy. But the problem is some AVMs are, too dangerous out surgically. Some AVMs don't respond to radiation. And so that leaves, a not insignificant number of patients without a real therapeutic option for treatment of their AVMs. And unfortunately, a rupture of an AVM can be a fatal proposition. So either patients can experience either a permanent, life-altering neurologic disability, or may ultimately pass away from a ruptured AVM. So really, new treatments are needed.
Great. So this is really the significance of the project of having more hope in this area. Okay. And how does this project help us?
Yes, exactly.
Oh, no, go ahead.
Oh no, you
You were
go ahead.
saying
Go ahead,
something.
Kat.
Okay. Yeah, so I was just kind of going more along the lines of how this project helps us identify and treat aneurysms, the AVMs.
Yes. So it turns out that about 50% of AVMs have mutations that are in two genes that we have studied extensively in the fields is studied extensively in cancer. And those two genes are KRAS and BRAF. And fortunately, there's been a lot of investigation into designing drugs that target mutations in those two genes, or the proteins that are made from the mutations that occur in those gene products. And this presents a unique opportunity because if 50% of these AVMs have a mutation that may be treated with a drug, then that may offer a new treatment pathway or paradigm for AVM patients. But the challenge with AVMs in particular is identifying which mutation they have. So in cancer, it's very easy to, or relatively easy, to obtain a piece of tissue that then we can sequence or send to the lab and identify those mutations that may render that patient a candidate for a certain drug. But AVMs and vascular lesions are much more challenging. You can't just stick a needle in an AVM and get tissue because that AVM, would hemorrhage. And so we've developed methods to obtain either a blood directly from the vessels that feed the AVM or within the AVM itself, or from blood that's obtained, from a normal peripheral blood stick, or using endoluminal biopsy or coil biopsy to deploy a coil in a region of the AVM, either through an arterial feeding segment or into an aneurysm or anywhere that we may be able to safely sample cells to see if we can identify those mutations that may render a patient a candidate for a drug.
Okay. And what would success look like in terms of how the project proceeds and the next steps?
Yeah, I mean, I think success would be really, I think, first and foremost to understand how the broader role of how genetics contribute to AVM pathogenesis. So, AVMs are very, very different. So there's,
Right.
an AVM that's really small, that's in the front part of your brain, that's easily accessible, is, a straightforward candidate to treat with surgery and can be completely curative. Whereas an AVM that occurs really deep in the brain, that's very large, can be dangerous to treat even with radiation, where swelling and swelling in that area of the brain may be present problems, or surgery with AVMs in other locations just present too high of a risk to be able to treat them. So I think that understanding the impact of how the genetic information and the mutational status of an AVM kind of dictates where that AVM arises. Is it in a spot that's really easily treated with surgery, or is it in a spot that's really dangerous? And identifying using liquid or endoluminal biopsy mutational status, especially of those AVMs that we don't have a good surgical or radiation treatment for, may offer those patients, a new avenue for therapy. So this grant will really directly enable kind of those first proof of principle studies to be able to discern whether or not a mutation in an AVM that arises really deep in the brain or an AVM that we may take out surgically and see how those differ so that we can hopefully improve care for those patients.
Thank you for explaining that. I know that pre-treatment and kind of guidance beforehand is so essential, and also for explaining the difference because I know I didn't even initially know the difference between a traditional aneurysm and an AVM. Yes, and
Yeah.
what would be like
Yeah.
timeline for for your research in terms of when this something like this could actually be available to the public?
Yeah. So, I think that really this study tries to address the key translational gap in that if you want to do any sort of randomized clinical trial of either drug therapy or even new novel therapies like using CRISPR-based gene editing technologies, really the critical step is being able to identify the mutation that is driving the AVM. So, this foundational work, I think, over the next couple years can really, really address that question in a rigorous and meaningful way so that we can eventually design clinical trials to be able to test, drugs that are already available on the market for other indications, mostly in cancer.
Thank you so much. And being with the B Foundation again, what does it mean to you to be working with the B Foundation again?
Yeah, it's been a really incredible experience. I think, as a provider, you have a relationship with your patients that is unique and special, and it's something that you can really experience on a personal level when you're across from someone, right before surgery or in those situations. But being able to meet patients from all across the US with these devastating problems, you realize, how much more of an impact your work can have on not only the people across from you, but the people that, you don't get to meet and you don't get to see, but whose voices are amplified through organizations like the B Foundation.
Yes, thank you. And I know that, it's given the community a lot of hope and understanding as the survivors and family members really seek to understand this. And as we've talked about, a little bit about the difference with, AVMs and traditional aneurysms, can you kind of comment a little bit about the link between the two?
Yeah, so I think that, that there are aneurysms that can be associated with AVMs, but they are
Mhm.
not kind of the traditional saccular aneurysms that we would see kind of arise spontaneously and or be detected, through either routine imaging for other reasons or through a scan that's obtained after a patient has a subarachnoid hemorrhage. But really, AVMs tend to present much earlier in life. So rupture of an AVM is the most common cause of atraumatic or without trauma hemorrhage that occurs in the brain of children. Whereas a aneurysm tends to present in patients that are much older. And so we know based on genetic studies of AVMs that they arise predominantly due to the occurrence of a mutation that occurs after or during development. And once that mutation occurs randomly, and in these cases are called sporadic, they can lead to AVM formation and pathogenesis. But the applicability of that sort of disease mechanism occurring in aneurysms, which are far more common than AVMs, has not really been established. And that's predominantly due to the inability to sample AVMs or aneurysms, in situ or in patients that are, actively undergoing treatment and not through analysis of tissue that we obtain, after a patient may pass away. So, this development of this technology and this project is really aimed at introducing, a refined, genetically driven tool that can enable different treatments for patients that we see.
Thank you so much for explaining that. As an awareness ambassador for the Bee Foundation, I've also gotten the chance to meet many of the other ambassadors and survivors, and there are some that have had AVMs, and so it's very meaningful and important to be able to understand that more. So thank you so much for touching on that.
Yes,
Yes, so we're
absolutely.
yes, thank you. We're very excited about all of this, and thank you so much for shedding light on that. And I'm very excited for your grant and the research that you're going to be doing.
Thank you, and thank you and Kat and Aaron and the rest of the B Foundation team. Could not be happier to receive this award, and especially thank you to Zach Yezi and the Yezi family for sponsoring this award. And we hope to have some positive updates here fairly soon. So thank you so much.
Thank you.